Hi, military, family, and friends, and everyone in between. I'm Miranda.
I'm Lauren. Thanks again for tuning in to Topic Tuesday. Our topic is PTSD, otherwise known as post-traumatic stress disorder. And it was once called shell shock or battle fatigue syndrome.
It's a serious condition that your soldier and any soldier, for that matter, could come home with. And matter of fact, let me tell you how common it is. It's said to be about 3.6% of adult Americans. That puts you at about 5.2 million people that's suffering from it right now. And 7.8 million people are estimated to suffer from PTSD at least once in their life. So we're going to start off with what PTSD exactly is, the symptoms, triggers, and some experiences that we've heard about and read about.
PTSD is a serious condition that can develop after a person has experienced or witnessed a traumatic or terrifying event, which serious physical harm occurred or was threatened. Happens a lot in soldiers. Simple things can trigger a PTSD moment. Sounds, smells, touches, nightmares. Some symptoms of PTSD often begin within 3 months of the event. The severity of the illness can often vary. Symptoms are grouped into 3 main categories: reliving, avoiding, or increased arousal. Some people repeatedly relive the ordeal through thoughts and memories of the trauma. This may include flashbacks, hallucinations, and sometimes nightmares. They may feel great distress when certain things remind them of the traumas, such as the anniversary of the date of the event. Your soldier might avoid people, places, thoughts, or situations that may remind them of the trauma. This can lead to feelings of detachment and isolation from the family or friends, as well as a loss of the interest in activities that the person once enjoyed. Your soldier can also show excessive emotions, have problems showing feelings of affection, have trouble falling and staying asleep, have outbursts of anger, and can't concentrate, and can be very jumpy with loud sounds. A soldier can also suffer from physical symptoms such as increased blood pressure and heart rate, rapid breathing, muscle tension, nausea, and diarrhea. Anyone can get PTSD, but it's more common in soldiers.
It's most common in soldiers and women. Also because women are more likely to be beaten when they're younger and raped and all that kind of stuff. Some of the experiences I've heard about, for example, there was a soldier who they were eating at a restaurant and just got back from deployment, and it was thundering and lightning outside, and it made the lights flicker, and I heard that he just hit the floor, and everybody around didn't understand what was going on, but that's a symptom of PTSD.
And I've seen soldiers at like the 4th of July events, the loud booms of the fireworks will cause them to be jumpy and paranoid.
Yeah. So, well, the next thing on our list is how it can be treated, and I was making sure I had that correct, and recovery. So, PTSD can be treated in 2 forms: therapy and medication. Medications usually consist of antidepressants or blood pressure medications. Blood pressure medications are mainly to help with nightmares. Now, the forms of therapy are cognitive behavioral, which is the ability to recognize and change their thought process, to recognize the symptoms and be able to catch it before it happens. Exposure, which is making the patient relive the traumatic experience.
I think that would be more traumatic than anything.
Yeah, I know if it was me, I couldn't do it. But the way that they do this is by introducing objects or situations that they know will cause the patient anxiety. So in my opinion, let's just let them drop dead then. So another one is, I did it right, okay. Another one is psychodynamic therapy. It helps the person examine personal values and emotional conflicts caused by the traumatic event. There's also family therapy, but that is mainly to help the family understand what the patient's going through and to help the family cope with the patient that's also going through it. Group therapy, which helps a person share their thoughts, fears, feelings, and experiences with other people that have also been in the same situations. And then the last one is EMDR, eye movement desensitizing and reprocessing. It's a complex therapy designed to alleviate the stress associated with traumatic memories. It didn't give me much more than that because we researched, we researched for a very long time, but it really didn't give me much of anything but that. So I'm not really sure what it is exactly. And the recovery process, you have to remember, it takes time. It's not going to happen overnight, so you're just going to have to be as patient as possible. The symptoms will never really go away. The treatment only helps cope, not cure. There is no cure.
But some patients have learned to hide it.
It's coping. It's noticing when you're going to have an anxiety attack or a pain attack or any type of symptom that's going to make you react. It's training you to automatically be like, okay, I got to move my thought process somewhere else. And preventing, the only way to prevent is if you're not military. It would be early interventions to help reduce, which is catching something before it ever happens, which nobody can guarantee that at all.
Or avoiding situations that could cause an outburst or something like that.
Oh, this is to prevent of getting PTSD.
Oh.
So therefore, I mean, there's no possible way you can prevent it. I mean, you'd have to be psychic.
It's life.
Yeah, you'd have to be like Superman or something. Okay, so the next thing on our list is dealing with anger and violence, and I think you can do that, or do I do how we can help? Let's do how we can help.
Yeah.
Okay. How the family members can help our soldiers deal with PTSD when they're coming home. The only thing is learn as much as you can about PTSD, because the more you know, the better you will be able to understand what they're going through and know the symptoms and know the situations as to help. Offer to go to the doctor visits with them. The main thing here too is to show tons of support. If they know that they've got that support, then that's a strong foundation, and anything with a strong foundation is going to build up and get better.
Now, don't get mad if they don't want to be around you at first.
Yeah, it says here to let your loved ones know that you are here to listen and you understand if they aren't ready to talk about it yet. Because, like I said, it goes back to it's going to take time. You're just going to have to wait and work it out as it comes. Take one day at a time. That's the only way to live it.
It's frustrating.
Yeah. Another one is plan family activities. Go to the movies. Go out to eat. Just try to keep them occupied, because one of the symptoms she said, or one of the things that causes them to do is exclude. They don't want to be a part of anything. So your job is to make sure that they're still keeping in contact with their family, because if they don't keep in contact with their family, it's going to cause more problems.
They're going to get into drugs and alcohol,
and it's going to keep them from being with their families, and it's just going to make them think more and be more on what is the problem when they should be trying to surpass it.